Hello, everyone, and welcome on this garden stage for another pitch session. I'm Rebecca Svej, and I will be your master of ceremony for this session. I'm happy to talk about health today because, as you may know, human health is really dependent on the health of animals and plants that surround us, but also on the ecosystem in which we're living. That's why we're coming here to consider a single conception of health: human, animal, and environmental health. We have selected 5 amazing projects that support this health issue, and I'm quite excited to listen to them and to share also with the jury, because you're here to listen to them, to support them, to challenge them as well with a Q&A session, and you will be able to pick your favorite as your coup de cœur, and this person will be able to pitch this end of afternoon with the other coup de cœur. Happy to get to know you. Would you like to introduce yourself briefly?
Hi, nice to meet you. I'm Alexandre, Investment Director at Ternel, a VC fund investing all over Europe from seed to Series B, with an impact thesis based on 3 pillars: restoring the planet, fostering well-being, including the health tech space, and empowering community. And I'm really happy to be here.
Thank you for being here.
Hello everybody, I'm Wendy Pierre. I'm the head of the emergency unit of Première Urgence International, which is a humanitarian NGO working in 25 countries in the world and specialized in health. Really happy to be there too. Thank you.
Thank you.
Hello everyone, I'm Céline. I'm working at AIATELLA Partners, which is a VC fund investing all around Europe in tech and deep tech projects. So we can invest, and we invest a lot in health tech. Happy to be here.
Hello everybody, I'm Jacqueline. I work for Plastro IP, which is a intellectual property firm. And more specifically, I work as a patent attorney. And our firm covers all fields of technology, but my specific expertise is in health tech and biotech. Thank you.
Thank you very much to all of you for being here. Are you ready? Okay, I think they are. Are you ready? Okay, I am ready. So I think we can go. Let's begin with the first project, which is called AI Diagnostics. Brad and Ben Breda, you'll tell us more about it. You know your project better than I do.
What do you think is the greatest infectious disease killer globally? Unfortunately, it is still tuberculosis, killing 1.3 million people every single year. And it's mostly because of late detection. At Diagnostics, we built a screening platform where we combined our digital stethoscope and AI models to detect tuberculosis by analyzing the sounds of patients' lungs. We did this by collecting the largest TB lung sound database in the world and building our proprietary AI model from that. We've tailored our product for nurses, which are often, sorry about that. We've tailored our product for nurses who are, they're often operating in noisy, harsh, remote environments. So our product features, which includes noise cancellation, offline capabilities, are essential for our ability to scale operationally. We've conducted clinical studies across 3 continents and shown that our detection accuracy aligns with the World Health Organization's endorsement targets. We've been approved to operate in South Africa, and we launched 7 pilots, of which we've converted all to commercial contracts, which equates to about 7,000 screenings a year. The symptom-based screening is simply, it's inaccurate. Our system detects 60% of the patients that are currently being missed by the status quo. Also, X-ray systems are so expensive that they are unable to scale as a TB solution, where our hardware is 65 times cheaper than the X-ray alternatives. We're also the only AI system AI stethoscope system that has been approved for tuberculosis screening. We're penetrating this $2.6 billion TB screening market and rapidly building our TB database while we're on the market. We leverage this to continually improve our TB screening model, and at the same time, we're also developing new detection capabilities that we then upsell into our detection platform. This allows us to expand our market into, to expand our market with a multi-disease screening solution. We're also breaking into the cardiovascular space with a rheumatic heart disease detection model, and also opening new markets with childhood pneumonia, CPOD, and asthma.
A smile is a great way to end a pitch, don't you think? Yeah, thank you very much. We'll have time to talk with you at the Q&A session. Thank you so much for AI Diagnostics. The second pitcher is getting ready to talk to us about AIATELLA. You can applause. Give him good energy right now.
Can you hear me? Yes, lovely. Great energy, but I'm about to bring down the energy, unfortunately, because as it stands today, 1 in 3 of us will die due to a cardiovascular disease. Just let that sink in for a moment. The good news is 80% of those deaths are actually preventable if we identify them early. But for that, we need medical imaging. And for medical imaging, we need radiology. But radiology is at breaking point. To illustrate that, let me tell you Scott's story. When Scott was 49, he was on his way to work and he had chest pain. He went in for a scan and was sent home to wait results. 6 weeks later, still waiting for his results, on his way to work, bang, he had a heart attack. It turns out that if that scan had have been read in time, that could have prevented Scott's heart attack. The issue is, radiology is at breaking point. There's not enough doctors who don't have enough time to process the amount of scans that are read every single day. For example, in the NHS, there's 133,000 images taken every single day. So there's the bottleneck. Doctors are burning out, but it's the patients that are suffering. And that's what AIATELLA here is here to solve. What we do is we automate the assessment of medical imaging, ultimately automating the measurements, taking analysis down from 60 minutes, up to 60 minutes per patient, down to 2. So it's a productivity play. Doctors can do more with less, which is, in this day and age, more poignant than ever. So we've solved the problem. Our technology is more precise, more reproducible, and over 100 times faster than current process. But up till now, I've been talking about patients that are already sick. So why wait until that point? It's our mission now to intervene years before these diseases become a problem. Preventative medicine is now a reality with AI. It's our vision that we want to live in a world where we have the power ourselves to actually prevent these cardiovascular diseases. And what we're demonstrating on the booth here today and tomorrow is actually how you can screen to prevent your stroke. And what I can say now, which is good and bad news, is we've already identified a participant of this event who needs to have life-saving surgery. So that's the best pitch that I could possibly give. Come and be screened, because we're here for today, but we're also here for tomorrow. Not just diagnostics, not just saving lives, but preventing disease in the first place. Thank you for listening. Last point, my apologies. Why we're doing it? We're doing it for people like yourselves, for the person whose lives we potentially saved today, and for people like Scott, because Scott is my father. Thank you.
Thank you very much. You can keep it. It's the first time that we have time left on the pitch. Good time management. We'll continue with Hekatech. The floor is yours.
Hello, everyone. I would like to begin with an example. Imagine you are at home, someone from your family make a cardiac arrest. You are alone. The first reflex is to call the 112. The second reflex to begin the CPR with the help of an emergency service. The third, the best, is if you have a defibrillator, but you don't have defibrillator at home, and you can't go on the cinema, on the McDonald's to search the defibrillator. You need to stay to make the CPR. But every second counts. It's what we want to change. Sorry. In France, 50,000 persons die after cardiac arrest. If we make a cardiac arrest, we have just 7% chance to survive. In France, 500,000 defibrillators, but if you make a cardiac arrest, you have just 10% chance a defibrillator comes before the emergency service. Sorry, I'm right. My English is not perfect. Our solution, it's a geoker. How it works?
Arrêt cardiaque à proximité. Nous avons besoin de vous. Flashez le QR code afin de savoir où apporter le défibrillateur.
This system is installed around the defibrillator with a company on the village. And when we have a cardiac arrest, when we have the information from emergency service, we have a cardiac arrest, we make our device on. The ID is to find one. We just need one person to flash the QR code and can help you with the cardiac arrest. The objective is to be more faster for the defibrillator. It's not just an ID. Joker, we have 300 devices, 70 intervention. For the moment, we work in France with city and with enterprise. Enterprise, we make the defibrillator. For the moment, the defibrillator is obligatory. And with our system, begin to be a societal action. We have a lot of support, Minister of Health, Fire Department from France. Sorry. Alors, what we need today? We need help to be more famous with a company, with a CSR, to install our system. We search investors, sure, to make more intervention in France and to go to export. I'm Frederic. I'm nurse, and I need you to help me. Thank you.
Thank you very much. Let's continue with HERA Digital Health. If he's ready, he is. Yes.
Hello, everyone. My name is Aral Surmili. I'm the founder of HERA Digital Health. I'm a Harvard-trained physician who spent the last 15 years helping refugees access healthcare. And as a doctor, I see the suffering forced displacement causes every day. If you put all the refugees and displaced people together as a country, they would have the worst health outcomes of any country in the world. Like Khalid, he's a Syrian refugee that I took care of when I was practicing. See, Khalid hated seeing people in white coats because he was vaccinated for polio 6 times in 1 year. It is because he didn't have his vaccine records, so we had to vaccinate him again and again. And for children like Khalid, everything is hard. When you relocate, you are forced to leave your home. You have to find schooling, a job, education for your children, and health loses its priority. That's why we created HERA Digital Health. We connect refugees with available health resources so they can navigate and thrive in the environments they live in. How we do it is when the refugees download our app or talk to our AI chatbot, we calculate the immunization or pregnancy care appointments for them and send them reminders. We keep their medical records together and safe in a digital place, so even if they have to change countries, they still have access to those. And we provide them with timely, trusted, and accurate health information in their language and in a culturally correct way. This way, they know where they can get health care or where they need to go. Our business model, even though we started as a nonprofit, relies on working with healthcare providers like ministries of health. where we can increase the uptake of preventive health services such as vaccinations or pregnancy prenatal care so that the cost of healthcare decreases that is on the healthcare provider. We started with 10,000 users in Turkey and now scaling to 150,000 users that will collectively impact 600,000 lives. And we know the refugee issues all around the world are here to stay, not to go. Our team has been supported by Harvard Innovation Labs, Fast Forward, USAID, and many others. And we hope that you join us in our journey to help save more refugee lives. Thank you.
Thank you very much. We can go back. Let's continue with La Maison de l'Artemisia in colors. I love it.
Oh, sorry. Oh, I don't need some.
No,
Okay, low tech. We are in the land of the low tech. So change now. It's time for change. We have started this change 12 years ago. In 12 years, La Maison de l'Artemisia has made systemic changes in 30 countries. We are changing the system of access to healthcare. We are changing the approach to development aid. We are changing the vision of food and agricultural sovereignty. How are we doing that? Our solution is very simple. It's Artemisia, the One Health plant. This plant is growing everywhere, in the middle of small villages, always available, cheap, and good for health. It's a One Health plant, effective in human health, effective in animal health, effective in environmental health, and with almost zero carbon impact. What have we done? In 12 years, we have planted Artemisia annua and Afra in almost every country in Africa and begin in South America and Asia. In 12 years, we have built a network of 130 local centers of expertise in 27 malaria-affected countries to help people to cultivate and use Artemisia medicinal plants. In 12 years, we have trained thousands of people, healing millions of malaria-sick people. In 12 years, we have created supply chains, awarenesses, and trainings in a social business model. In 12 years, we have accelerated agronomic and health researchers into Artemisia herbal tea and assisted in the publication of medical studies in scientific journals. In 12 years, we have demonstrated that there is a robust model that does not depend on large international institutions. We have local One Health solutions accessible to all, to empower populations without depending on foreign public funding. Today, our Artemisia solution and our model are a huge hope for local actors and a major development challenge. Today, we build partnerships in all countries, like with the HERA Foundation or Aga Khan University.
Thank you very much. You can stay with me because it's Q&A session and keep your plant. Okay, let's welcome back AI Diagnostics, AIATELLA, Hekatech, HERA Digital Health, and La Maison de l'Artemisia. Dear jury members, we have 5 minutes, 5 pictures, so let's say 1 question per picture, whenever you're ready.
Yes, I can start. Thank you. Well, first, congratulations to everybody. It was very interesting. I have a question for La Maison de l'Artemisia.
Yeah, can you close? Yeah.
Yes. So you say in 12 years you have already done a lot. What are the next steps that you want to carry out?
Work. Ah, yes, it works. Sorry. Next step, to be in countries we are not. So essentially in South Africa, and to develop in Asia, to develop in South America, and to help researchers. We have a tribune in Le Monde today. And we want a RCT, randomized clinical trial, on this plant for malaria, for bilharzia, and for other very debilitating diseases. Thank you.
Thank you very much.
So many questions. Maybe for AI diagnosis, what is your go-to-market? Who are your customers, and how do you want to sell your product?
Well, I'm so glad you asked that, because that was the ask in the last slide I got cut off for. So our go-to markets, we've got two different types, where in South Africa we're building our own market access just because we have the connections there. But in Sub-Saharan Africa and in India and Southeast Asia, we're looking for go-to markets to really get into that. There's a mix of possible options, some that are actually in the tuberculosis space on the bacteriological diagnostic side, so on the end, at the end of that pipeline, and also pharmaceutical companies that already have that presence in the space. Our actual customers are NGOs that are conducting TB screening, national departments of health, but we've also got quite a strong private side in the mining industry and other construction options, and then also prisons and refugee camps, which we'll definitely be chatting about later as places where our product will be used. And our customer is not the nurse, although the nurse is the user. Our customer is the organization or institution hiring the nurses.
Thank you very much.
Thank you very much, everybody. I have a question for HERA Digital Health. I wanted to know about your expansion plan or developing plan, because you said that it's already in Turkey, and I wanted to know, like most of the refugees are in really remote areas. I'm thinking about Sudanese, for example, refugees. So what would be the challenge, and how you plan to expand regarding the cultural aspect, language aspect, the technology, because some of the refugees, they are just not at all at ease with the technologies, and the fact that it is an online system or an offline system, because you said that it's regarding IA, so I'm really curious about that. Thank you.
Yeah, that's a great question. We work with refugees who live in rural areas, but also in city as well. One thing we saw, and one of the reasons we started with a mobile app, is the mobile phones are one of the most important instruments they have. Because if you imagine, and you would know this, but if you're, all around the world, that's the only way you can get connected with the people that's in other places, and that's how you get information. But now what we've been focusing over the last 2 years is actually using it or making it more offline first. So there are still online capabilities that can wait until the person can get online, while they can access many of the information offline in their phones. And one way we do it is using WhatsApp. The reason for that is it's very frequently used among refugees. And WhatsApp spends, and I'm not, advertising for them, but spends a lot of energy on making it work in the lowest connectivity possible. And in expansion, we like to work with local partners who know the area, because we're not I'm from Turkey. I know very well the Syrian refugees, but let's say we're working in Latin America, we would work with local partners and NGOs in order to, scale.
Thank you very much. Thank you.
Thank you, everyone. Quick question for AIATELLA. Excuse me if I pronounce wrong. Could you tell us if your product is hardware or software based, and elaborate a bit about the features?
The features?
The features.
Yeah, so it's absolutely software based. So it works, it's hardware agnostic. So from the most high tech, hardware that there is that fits in your pocket, but also to, if we're realistic, the old dusty machine that is widespread in most hospitals. The features are ultimately detection of disease, quantification of disease, but then actually risk stratification. So we're not just going to tell a patient, you have disease, good luck. We're actually telling the physician how to then treat that. So it's an informed diagnosis with informed treatment, shortening time to diagnosis and improving that patient outcome.
So you have a foundation model trained on a lot of images that you labeled to help the radiologist to diagnose.
You didn't get.
Yeah, that would be accurate, but it's not simply detection, it's also quantification. So there's that measurement, which ultimately is a safety net for that clinician. So that's trustability and explainability of our AI.
Okay, thank you.
Maybe one. Yes, Ali. 1 more minute, 1 extra minute.
Yes, I have a question for you, Hekatech. Like you are thinking, it's really great project. I did the PCR like a few weeks ago. The main issue for me regarding this is the training of the people. In France, less than 5% are trained to use this. How do you plan to make the connection with the awareness session regarding the main population?
Yes, it's difficult. We make a connection with the Ministry of Health to make sensibilization campaign. We can make with it's too hot to drink something and for cardiac arrest we make nothing, and it's a problem. But the ID, it's easy to use. Everyone can take the ID and use and say all. And it's a chance with our system, the person understand you need to take the ID, and after when he opens the box, he understand what he need to make, and the emergency service explain all on telephone with the person from CPR.
Thank you very much. Everyone had a question? Yes. Thank you, jury. Congratulations on your project. Thank you so much for the inspiration. Good luck for the rest of the development. I hope you find support. I'm sure the jury will be happy to talk with you in the networking area. Before that, last mission for you, elect your coup de cœur between all those amazing projects. Good luck, because I loved all of them. Thank you so much for your contribution as an audience, and I'll see you a little bit later.